A lot of people come to me with this question. I even have felt this myself, where I initially started a skincare routine, my skin was doing better, and then it felt like it plateaued.
Right. So why does your skincare peak? Can you break through this ceiling? We're going to talk about the reality of building a topical skincare routine, how to do it, and how to break past that barrier.
Dr. Maxfield has come up with one of the best graphs and explanations that I have seen in skincare. And it's something that I actually discuss with all of my patients now, is how do you break through those plateaus? So in this video, we're going to be talking about breaking your skincare goals. Here we go. First, let's show you this graph, because I really think that it's genius, and I actually think it's going to help a lot of people understand why they've reached a plateau in their skincare.
So the basics here, if you look along the x-axis, this is the one that goes from side to side. This is what you're adding to your skincare routine. So it goes like wash face, ingredients, and more and more and more. If you look at the y-axis, the vertical axis, this is how much gains you're getting, the improvement that you're hoping to see. And so the first thing we have is washing your face. And it may sound crazy, but the vast majority of people don't even wash their face on a regular basis, especially those who don't wear makeup or sunscreen. Washing your face is the first step in your skincare routine, and it does a bit for you, but as you can see, it doesn't move the needle a whole lot.
So washing your face is usually your first introduction into skincare, and this will slowly move you up that graph, but you still see that you're at the bottom of the graph making small skincare gains. And then the next step is to add things that are really foundational to most people's skincare routine. And the number one thing there would be SPF. And a lot of people are thinking, well, am I going to get any skincare gains with SPF? And I truly believe, even in my own skincare routine, by wearing sunscreen every single day, that I actually see an improvement in the quality of my skin. The redness, the luminance, the radiance of just wearing sunscreen in one day, I can notice a difference. The inflammation that the sun and UV exposure causes throughout the day, you may not notice it perceptibly to the human eye every second, but there is this baseline inflammation that occurs if you're not protecting your skin. So this is going to be the foundational thing that moves you to the next stage of the ladder.
And then the other foundational cornerstone, I think if you had to just do three things in a routine, it's always going to be wash face, sun protection, and then some form of retinoid. This is just like your prototypical cornerstone aging and acne ingredient. And this combined with sunscreen just moves you up the needle. No, it moves the needle up, fills up the gas tank, it moves you up the ladder. It does so much for your skin, just these three steps, that this is like the foundation of your healthy routine.
So now you're cleansing, you're using that foundational retinoid, you're wearing SPF every day, and then eventually you're going to plateau unless you keep adding in new ingredients to your skincare routine. And so this is where you're going to start adding in those targeted treatments. Like if you have hyperpigmentation, adding kojic acid or a prescription hydroquinone, that's going to keep moving you up this line here. And then above that, you're going to be adding those supporting ingredients that are maybe not as active, not as targeted, maybe not as doing as much in your skincare routine, but are just complementing the rest of everything that you're doing. Something like a niacinamide, something like even a vitamin C, I consider to be a complementary skincare ingredient. And then eventually you've kind of maxed out everything that you can do with topical skincare. And that's where you're going to reach that first real plateau in your skincare routine.
And I think this is an extremely important thing to communicate to you all, because so many people will drop this like the skincare is just snake oil, like it doesn't work. And I think the reason that most people will say this, experience this, is they hit this plateau. Like they just get to a point where they've used things over the counter, and there is a reality that it only takes you so far, especially when it comes to very significant things like the aging face or even deeper acne or acne scars. Topical ingredients do have real limitations. And that's also why I think the value of dermatologists, plastic surgeons on social media is so valuable, because they can not only communicate what can help elevate you beyond this point, but they've seen it firsthand. They live in both worlds. They do the topical over-the-counter ingredients. They sell the over-the-counter ingredients in the office. They also do prescription ingredients and procedures. So they have a real-world view of what can elevate this even further.
So you're maxed out. How do we break through that next level?
This is interesting and evolving, because every year we see the technology and cost improve with devices, and we see more at-home devices. And it's such a tough thing to balance as a doctor or as a professional, because one is safety. We want to make sure that things are safe for you at home, at least reasonably so. But then we have to balance that with efficacy, because things are becoming more effective and more accessible. So I'm actually pretty excited about the at-home device world. Again, it does not mimic completely. It certainly does not replace the in-office devices and procedures, but there are more things that you're going to have access to, even just over the next couple of years, that I think will be beneficial to your skin.
Now, what's available at home is getting better and better. It's always shocking to me what's available. And I always try to balance this with the safety of doing things at home. But ultimately, I do think that now more than ever, people have excellent tools in their hand to improve their skin. And then eventually, with what's available at home, at least currently today, you're going to reach another plateau. And then that's when you go and you see your dermatologist, your plastic surgeon, who is going to break you through that next level. So you may be happy at any one of these plateaus where you say, my skin is healthy enough and I don't want to continue up this ladder. But if you said, okay, how do I keep going up this ladder? That's when you go on to procedures at your dermatology office. Now, anyone who has seen me as a patient, I always try to maximize skincare first. It's not good for business by any means. So when people come to see me, the first thing that you would think that I would do is try to say, hey, you need to get this procedure done. But actually, the first thing that I say is, hey, here's a bunch of different things you should be doing for your skin topically, whether it's prescription tretinoin or starting an SPF, especially if they don't have those foundations in their skincare routine. I actually make them go on a 3-month journey of actually maximizing skincare before adding in any procedures, because I do think that even with the best procedures, you will see results, but if you don't have the foundation of that skincare, the first part of the graph, then the rest of it actually falls apart as well. And so you won't maintain the results with your procedures won't be as effective, and then you'll actually just be on this like stepwise up and down pattern where you're actually making no forward progress.
It's such an important point. You cannot flip this upside down. This is like, some may say a pyramid, like some may say. And if you just take this pyramid, you flip it upside down, it all just collapses. Like your skin cannot live on procedures alone. It needs the bread of your topical skincare. With that in mind, what we can do now, we're actually going to take you through how to build a skincare routine. It just like occurred to me during this video is like, this is actually how you need to approach building a skincare routine from start to finish. So very quickly, we're going to show the basics of building a skincare routine for the beginner, for the intermediate, for the expert, for the like astronaut, for the extreme skin enthusiast, the extreme skin enthusiast. So here it is from front to back.
So I still think the foundations of what we've always talked about is still true, which is cleanse, treat, and protect. So finding a cleanser that's specific to your very skincare routine, your treatment, the first part of the graph, whether you're going to be using retinoids and a brightening agent together, something like a kojic acid, whether you're going to be targeting texture and adding in some exfoliation acids, that's going to be up to you and your skincare goals. But your skincare routine here is treat and then protect, which is going to be moisturizing at night and using sunscreen in the morning. And that's going to be the entire first part of this graph. Cleanse, treat, protect.
Yeah, so if you're going shopping, all it does, it looks like this. You're going to the store, you look for a cleanser. You bought your cleanser. Success. Ching. Next thing you look for, is probably your sunscreen. Got your sunscreen? Check. Moving on. Now you pick your retinoid, assuming you're going to go over the counter. Purchase that. Perfect. And now you move up to the targeted and supporting ingredients.
So targeting and supporting ingredients, if you have dark spots, you could be adding in the hydroquinones at this point, the kojic acids, the silymarins, the arbutins, things that have been shown to help with dark spots. If you have texture, you may be adding in your exfoliating acid, your glycolic acid, your mandelic acid. This is going to be very specific to you. And then above that is those supporting ingredients. Do you want to sprinkle in some niacinamide? Do you want to throw a vitamin C in there in the morning? Maybe you even want to add some snail mucin for hydration. That's going to be totally up to you. But eventually, you're going to reach that first plateau.
So now you have picked your products in a stepwise fashion. By the way, you're going to live with probably each one of these steps for a few months before you try to aggressively move forward. But let's say you're 3-6 months in, you've done all the steps up to this point, and you're like, I'm still not at goal. So whether it's acne and you need to see a doctor for oral prescription options, or whether it is just aging textured skin, then you're going to add in specific things. At this plateau, you have to break it with, like, again, procedures, devices, or what I'd like to say innovation. Part of innovation is just like, how do you make over-the-counter or just simple technology better? And one of the things I love microdarts. If you ever heard me talk about or us talk about pimple patches before, I always hop in with like, oh, the extra dart, the extra patch with the ingredients in the dart, because this breaks the stratum corneum. This helps these things absorb better, and it helps elevate the ingredients well. So an example of this that I love is the Cure Micro Infusion Targeted Patches. You see microdarts used in a lot of settings, especially in eye care these days. Packaging is nice. It comes out in a little drawer. But the whole concept is these little needles break its skin barrier to increase absorption, do it in a sterile, clean way, but they contain, very thoughtful, caffeine, copper peptides, niacinamide, glycerin, hyaluronic acid, allantoin, retinol, which is like your ideal retinoid for the skin around the eyes, and of course, green tea, and then hexapeptide. It's just like loaded. I'm trying to think like what else would I want, but it's pretty much everything you would want for that skin around the eyes.
What's really exciting to me about this ingredient list is specifically the copper tripeptides. So I'm a big fan of copper peptides if you've seen our video before. But really exciting is acetohexapeptide 8, also known as argireline. So argireline is a Botox-like peptide. I have actually noticed that it really does help with fine lines by basically stopping that muscle contraction. And so to have this in a very targeted patch, especially around the eyes where most people will notice their first wrinkles around their eyes, is genius.
Or you marry that idea with the devices. So I'm not a fan of derma rolling, even though functionally it works. I'm not a fan of at-home microneedling because I don't think the safety is quite there at home. They can be a little too aggressive for non-professionals, I think. But then you do have the microstamping, which I am actually a huge fan of because I think it very deliberately marries the safety and efficacy in the over-the-counter space. And the same concept, though. It not only breaks stratum corneum, helps ingredients absorb better, but it delivers them deeper into the skin. So for something like epidermal growth factor that struggles with absorption, it's like a perfect option.
Another option that you have at home is using LED masks. You've seen these all over the internet, and you've said to yourself, do I need one of these LED masks? And I think a lot of people make the mistake of skipping the first part of this graph and then going into an LED mask and then saying, I'm not seeing any results. And that's because this is something that's getting you to that next stage. It's not the foundation of your skincare routine. So once you're doing everything else, and then you've noticed that plateau, a lot of people will notice a huge improvement once they start using LED or they start using microstamping because they've reached that plateau, and that actually does have a noticeable benefit once you've reached that plateau. So you don't start there. It's not the first thing that you do. If you're not being consistent with the skincare routine, the first thing you do is not go on to these at-home devices. So I know a lot of people that try to jump and skip steps here, and they try to go to those at-home devices before they get the foundation. So this is where it's really important that it's the next stage, and that's where you're going to see that breakthrough, those real results with LED.
Yeah, such an important step. Sometimes I kind of feel bad because we talk about these devices and we can't always caveat this, but it is a supporting role. It's not a foundational ingredient, a foundational product. It helps take it to the next step.
Well, a lot of people, they see an ad and they see the results of a potential device and they think, I need that now, right? And the context is not with everything else around it, which is the supporting skincare. And so I think that's where people they feel like they've gotten duped or whatever, is because they don't get the education that comes before that.
Yeah, which is, again, another reason I love long form content. It's just a passion of mine. But also we're seeing at home things that I like at home. I think Radiofrequency is like a relatively safe technology. And I do think the at-home devices have really stepped up in terms of like quality for Radiofrequency. I also used, we've talked about this a few times, the home IPL hair removal devices. This is like borderline because you can definitely burn yourself with IPL devices. I have tried quite a few of them. I do not believe they're as effective as in the office, but they're super convenient. They do work decently well. The ones like the You Like one with instructions, I think they've done an excellent job. Very clear instructions. They really tried to make it safe. The cooling portion of this is very effective. So I'm a big fan of that. And I think for lighter skin tones, because you can have a higher setting, it can actually work pretty decently.
With these devices, I've always been very cautious because my concern is that you get the ad without the backstory, right? And so it can be very difficult for people to know that this is how you use this device. IPL can burn you. The worst burns I've ever seen in the office are from IPL, not home IPL, but procedural, like in-office IPL, someone going to a med spa and having darker skin tones or having a tan and getting IPL done and ending up with really serious burns. So these high energy devices, because they're effective, can be dangerous without some of the education behind them. And so this is where you've already had a lot of education that you start to incorporate these things into your skincare routine. And then you've kind of maxed out those at-home devices and you come in, you see your dermatologist, and then they say, hey, I really think that Erbium is going to get you to the next level, or Halo, or Fraxel, or Clear and Brilliant, or maybe even, an oral prescription for dark spots like tranexamic acid. So that's where you're really going to have that discussion with your dermatologist. And that's where you're going to see the maximum benefit of these procedures because you've already maxed out on everything. You're doing everything at home. You have the full routine that we walked you through. You have maybe something that's a little bit elevated in that procedural innovation space. Maybe you don't. And then you're now onto procedures in the office where you're going to see that maximized benefit of all of these things coming together and culminating. And that's when you see people with that like really glass skin where you're saying like, how did they get there? And it really is going through this stepwise fashion. And the other thing that I want to add to this graph, without going on for too long, is that this graph looks very linear. And that is if you zoom out on it. But it's really important to know that if you were to zoom in on this graph, that you would see periods where your skin got worse. And that's just the nature of it. When you take a snapshot and you take a look back at life, it's a continual progression forward. However, there are moments where a month you just notice your skin is getting worse. It's looking more dull. You have more dark spots than ever. Maybe you got some sun exposure. Maybe you had some acne breakouts that set you backwards a little bit. And that is natural with skincare. That is natural in this progression, is to have these little divots where you're going down. But it is a net forward progression if you stick with it and are consistent.
Yeah, that's a perfect caveat. Very realistic expectation is set with that. I think is super valuable. So yeah, if you need to break through that barrier, if you feel like topicals just are not doing it for you, that's understandable, that's reasonable, and that's real. So you just have to go and explore for innovation, procedures, devices, or prescription, and those can help elevate it and break that glass ceiling. Is it all glass ceilings, or is this just a ceiling? They can help you break that ceiling.
Hope this graph is helpful. It helps me a lot when I'm explaining things to patients, and I've used it in practice. I actually draw it out for people. I say skincare is going to get you here. You've plateaued. We're going to get you here with the next step. And so this is a really good way to look at things and a really good way to understand how to maximize your skincare routine. Foundations are critical, though. I tell every patient they do need a foundational skincare routine in order to have any procedures done. So thank you for tuning in. Please like, comment, and subscribe, and we'll see you in the next video.
We'll see you next time.